Hey, welcome to Doc Talk Live. I'm going to start this show a little bit different today. This is urgent care and COVID. I'm Dr. Goodman. I'm with Joe Ingram, who is our hand specialist, our elbow specialist, and I'm with Meg Gilmer, our foot and ankle specialist. And so that's sort of the new handshake. This is outside. I'm going to walk in because I don't have my mic right, and we're going to go inside. And hopefully it's a little bit quieter or you can hear us better in here. Appreciate y'all doing this with me today. Things are changing awfully quickly, minute by minute, and I struggle even doing this show because usually I will shake a hand. That's how I would start any Doc Talk Live. And now, everything is changing. And so what I wanted to talk to you guys about, come a little bit closer if you can. I know we're supposed to keep 6 feet, but it's hard to keep it in the shot. And if there's questions, please type them in. Maybe our hand specialist, our foot specialist, or me, we could get to them later on a rebroadcast. But because we can offer urgent care services, I thought it would be good to go a little bit through the facility. But things tend to be changing. What are your comments, Meg, just on how we keep people safe and how we are navigating this? Because there's so much information coming at us so quickly.
Right. So I think a lot of our challenge is trying to provide care that's going to protect you from the virus as well as us from the virus. And one of the things we've decided as a group to do is to try to stay open so that we can see urgent patients and try to keep them out of the emergency rooms, out of regular urgent cares where you may have a higher risk of exposure. Things like ankle sprains, falls, even fractures we can take care of here faster and more efficiently with less exposure than if you went to a hospital.
Let's walk around. Maybe it'll be quieter in another part of the facility. Come on this way, Seth. Oh, it's even quieter in here.
Yeah.
Maybe this is even better, or well, let's head through the clinic. Let's just head through the clinic. After you.
Thank you, sir.
Thanks, Joe. Go ahead, Seth. Great. Just head through the clinic. Although we might end up heading back there because it's so quiet. So here is MRI and CT. And so I will say, ideally, it could be that as we move more and more toward telehealth, patients could come in and we know on the front end what imaging we need. And we get that imaging and they leave. And then via telehealth, we can evaluate these images, talk to the patient, and come up with potential plans. What are you seeing, Joe, as far as urgent care, especially with wrist, hand, elbow?
I mean, a lot of it's the typical things that I would see on a normal basis. Anyone that has a fracture, of course, whether it be a wrist, a hand, that needs to be seen. People with numbness, tingling, that's incredibly irritating. So that doesn't really prevent people from coming in because of the nature of that pathology. So I'm seeing a lot of my typical things that I would see on a normal basis, and I agree with Meg. I think that's the importance of being open and being able to treat people in the same way that we would, having adjusted some of the clinic flow, trying to avoid people in crowded spaces and waiting rooms as such, even for MRI right here. Just, having people wait to come immediately to a room.
Yeah,
that way they're not being quite
I don't
so
know
exposed.
if people noticed, but when we were outside, we had patients waiting in cars or family members waiting in cars. We're gonna run upstairs to the procedure area. I think it'll be quiet up there as well. But again, Seth, if you could just get in the shot just to show the MRI, so people know that we have imaging here. So like a hospital, that's good. And then come on out here, Seth. And then there's X-ray here. You can point to the X-ray. Can you see the X-ray sign? You see the x-ray sign? Yeah. Good. All right, let's go this way. Come on, guys.
Okay. Just have a seat before you are ready.
Any questions on the monitor, Seth, that you can tell about, or?
Not quite yet. We do have some viewers.
Okay. And I'll just say, if people have questions, try to type those in. Seth is working the camera, but Seth probably knows more medically about the COVID thing than probably a lot of people. Seth is one of those very intellectual guys. He was telling me how we're going to get some 80-degree weather here, and that's going to help kill the virus because it won't be able to stick to the surfaces as well. Why is that, Seth?
It's got an envelope. It's a positive stranded RNA virus, and it's a type of virus very similar to the flu, but its genome has a little envelope around it that can sometimes be sensitive to temperature.
So we're now in our recovery room area. And it is kind of quiet in here. We do have some procedure rooms back here behind us where we can do procedures. And I think this is one of the challenging things, figuring out in today's environment. I know when I was in medical school, we had a class on ethics. And they would present various things that presented ethical challenges. And so one of the struggles we have is, how do we determine what's urgent and what's not urgent? And if this virus gets really bad, how do we decide who gets a ventilator and who doesn't? And how do we decide who wears a mask and who shouldn't be wearing a mask with supplies being limited? So that's caused me a great deal of distress. I'm curious, guys, what your comments are on really some of those issues.
I think right now we're using a test of, if we wait 4 to 6 weeks, what is the permanent harm to somebody? If you have a broken leg, if you don't fix it now, 4 to 6 weeks from now, they're going to have permanent, potentially lifelong consequences of that. I think the same thing we have to look at in terms of pain. Like if you've got something that is causing you to take a lot of pain medicine right now, say an acute herniated disc or something, that it's a very painful condition, and the options are to do a small procedure to maybe alleviate your pain or put you on narcotics for who knows how long. I think in this day and age, from the DEA's standpoint, that constitutes something of an urgent situation. So I think there's different definitions depending on, how strict you want to apply that criteria. But I would say if I'm having to give somebody 4 pain pills a day, we're not doing them a service by putting something off that's small down the road.
And Joe, how would you answer that question, or would it be the same? You did such a great job with that question, Meg. Yeah, I meant for it to be a hard question, and you just nailed it. Go ahead.
I do agree. I think Meg was spot on with that. But at the same time, in those medical ethics classes, there are no correct answers, right?
Right.
I mean, like there's just it's various shades of gray. There are, you get a couple of black and white questions in that.
Right. Right.
But this, I think, is on the spectrum of gray, and I think you just have to weigh the risk benefit. As with all things we really do. In terms of surgery is we do it frequently, but it's no small undertaking. You can always have complications with surgery, but you have to weigh out the risk benefit of doing that versus not. And I think it's the same scenario with people coming in. We don't work on cars, we work on people.
Yeah.
So
I think
we have to have an honest conversation with people.
I think we're fortunate here that we're not in the hospital, we're not attached to the hospital, but we have pretty much all the services that a typical umbrella hospital would have under one roof. So that is that is ideal for an urgent type of situation. Seth, is there any questions, or can we just leave it there? And
Sure. Yeah. You guys rock.
okay, that's about it. All right. I want to thank you guys again. I'll give you the elbow. I'm going to give you the foot. What happened to your foot?
I broke it 4 weeks ago.
Oh, that's right, with Ultimate.
Yes.
Okay, all right, very good. And maybe people will type in questions. Maybe we'll do it again depending on the response, because then we'll get a better idea of what questions people have. Okay, thanks a lot, guys. Appreciate it.
Yep.
Thank you.